Hey everyone, it's Sarah, the registered nurse, RN.com, and in this video I'm going to demonstrate how to interpret the systolic and diastolic sounds when taking a manual blood pressure. First, gather your supplies and perform hand hygiene. Position the patient properly, ensuring their back is supported, their arm is at heart level, and their feet are uncrossed. If necessary, support the arm and make sure their palms are facing up. Then find the brachial artery near the top of the elbow's bend. Place an appropriately sized cuff on the patient's bare skin and secure it in place. The cuff's base should be about 2 inches above the elbow bend, and the cuff's arrow should be in line with the brachial artery's palpation point. Attach the gauge to the cuff, making sure it is easy to view. Then tighten the valve on the bulb by turning it in a clockwise direction. Remember the phrase, righty-tighty, lefty-loosey, and make sure the gauge reads 0. Next, estimate the systolic pressure number, first by palpating the patient's brachial artery as you pump the bulb. The point at which you no longer feel the brachial artery is the estimated systolic pressure that you need to remember. Our patient's is 116. Then deflate the cuff by turning the bulb's valve counterclockwise and wait 60 seconds. Next, put on the stethoscope, palpate again to find the brachial artery, and place the stethoscope's bell or diaphragm over the brachial artery without occluding it. Confirm the gauge is at 0, tighten the bulb's valve by turning it clockwise, and pump the bulb until the gauge reads 30 millimeters of mercury higher than the estimated systolic number that you noted earlier. So based on our patient's estimated systolic pressure, we're going to inflate to 146 millimeters of mercury. Then slowly turn the valve counterclockwise until the needle begins to drop at a speed of 2 millimeters of mercury per second. Listen closely for the first sound to appear and note the reading on the gauge. This is the systolic blood pressure, which is the top number you need to remember. Continue to allow air to leave the cuff and note the point on the gauge when the sound stops completely. This is the diastolic pressure number, which is the bottom number you need to remember. And I do just want to point out that in the past, the last sound heard was a diastolic number, but now many guidelines consider the diastolic to be the point at which the sound stops. Now let's listen for the systolic and diastolic numbers together to help you understand how to determine the patient's blood pressure. In this example, our patient's blood pressure is 110/70. Fully open the valve to deflate the cuff. Then remove the cuff, clean your supplies, and perform hand hygiene. And then be sure to document the blood pressure reading and the arm that was used. Okay, so that wraps up this video on how to take a manual blood pressure. And if you'd like to watch more nursing skill videos, you can access the link in the YouTube description below.